coordinator for the Maryland Department of Health's Developmental Disabilities Administration. We welcome you to our Waiver Advisory Council meeting. If you would like to use closed captioning so you can read what is being said, click this button. Sometimes the transcription is not exact, but it is pretty close. Today's presentation is available in the handout section. Click here where you see the paperclip to download the presentation. All attendees are currently in listen-only mode, and your mics and cameras are turned off. If you have a question you would like us to read and answer, click here where you see the question mark to add your question. Before beginning our meeting, we want to ensure civility for all meetings. The free expression of diverse viewpoints is a fundamental value of our group. This freedom carries a responsibility to engage respectfully, which means treating one another with dignity and respect and good faith. Uncivil behavior, disruptive conduct, abusive language, threats, or harassment will not be tolerated and may lead to being excused from the meeting. Thank you for helping keep this a productive and comfortable meeting for everyone. And now I'd like to introduce our Director of Programs, Federal Programs, Rhonda Workman.
Thank you, Eric, and welcome everybody to our December Waiver Advisory Council. It's so great to see those that have been able to join us in person and see those that are joining us online. There is a slight delay when we move the slides, so we're going to have a couple pauses just to let everybody know that. And we're just checking to see if our co-chair, Charlotte, is on. Oh, great. Charlotte, would you like to start with the welcome?
Yes, hello everyone. My name is Charlotte Whitaker. I am a participant in the self-direction model and the co-chair of the Waiver Advisory Council.
Thank you so much, Charlotte. And again, my name is Rhonda Workman. I'm the DDA Director of Federal Programs, the other co-chair for the Waiver Advisory Council. And we're just seeing, we know some of our leadership is in other meetings, but just checking to see if Robert is online and wanted to add some additional comments.
Yeah, thank you, Rhonda, and good afternoon, everyone, and welcome to the Waiver Advisory Council meeting for the month of December. Just want to thank everyone for taking the time out of their day to join us, and look forward to a productive and fruitful meeting.
Thank you so much, Robert. So let's review the agenda for today's meeting. So as we're presenting, you'll see we started with our welcome. Charlotte is then going to bring up and request the approval of the November meeting minutes. This will be followed by DDA updates and discussions. Then we'll have work group updates and discussions, share some resources, and then public comment. Before we begin, a few things to let everybody know. We will be engaging in discussions, and first really looking forward to the opportunity to hear first from our people with lived experiences as we go through the different topics. The council members then will be discussing and sharing information and commenting and providing some advice and recommendations. For the public that is joining us today, we really appreciate you joining us. We look forward to your input too. Your input will be requested at the end of the meeting. There is a designated public input process. So as we go forward, if you'd like to put information in our question box, that's great. We will not call on the public until the end of the meeting so that the council can conduct its business and have the dialogue. So can we go to the next slide, and I'll turn it over to Charlotte.
All right, thank you, Rhonda. So here are the ground rules. The ground rules make sure that, everyone is contributing their ideas in the best and most respectful way so that we can all hear each other's points of views and go from there. So the ground rules are: assume positive intent, speaking one at a time, using plain language, sharing information openly, listening to different points of view and hearing it, staying flexible and open-minded, participating actively to ensure that everyone's points of views are heard and accounted for, engaging respectfully and politely, and minimizing distractions.
All right, can we go to the next slide, please? And I'll turn it back over to you, Charlotte.
We are now going to ask the council if there are any members who would like to amend or change the November meeting minutes. If there are no hands raised, or anyone with any amendments or changes, we can move to approve. So if anyone would like to vote to approve the November minutes as is.
Yeah, thank you, Charlotte. We've got 2 hands in the room.
Oh, perfect. Okay, great.
People online. So I think one is making the motion and the other
Oh,
one.
yes, the motion. Okay.
Great. Let's go to the next slide. And I'm going to ask Nicole Williams to, if you go to the next slide, Nicole Williams will share an update related to the DDA membership.
Good afternoon, everyone. I am Nicole Williams. I am the Division Chief of Quality Enhancement. So for membership updates, we can go to the next slide, please. All right, so we have several still current vacancies that are outlined here. They include the support broker. We are still looking for participants who use both the community provider managed and also the traditional service delivery model, sorry. We are also looking for coordination of community services provider and family members, both within the self-direction and traditional service delivery model. You can go to the next slide. Okay, so currently we still have several applications that have not been submitted from current council members. So if you guys can please, we are asking if you can submit them by December 31st of this year. If you are having any difficulties with submitting your application online, I am available to assist. I can also give you a hard document to also complete, submit back to me, and I can finalize the whole entire process. So anybody that's left outstanding, please, please, please submit them by the end of the year. Does anybody have any questions on membership? All right, then we can go to the next slide. Thank you.
Thank you so much, Nicole. And now we're happy to introduce and turn it over to our Medicaid partners. Elisa Jones from the Office of Long-Term Services and Supports will be sharing some information related to the federal Ensuring the Access to Medicaid Services Rule, also known as the Access Rule. Elisa?
Thanks, Rhonda. Good afternoon, everyone. My name is Elisa Jones, Assistant Director of Community Integration Programs. Like Rhonda mentioned, I work for the Office of Long-Term Services and Supports. We are the state Medicaid agency. Could you go to the next slide, please? Thank you. So here is a visual of the timeline for access rule compliance. I want to talk a little bit more about some of the specific access rules, but this illustrates the timeline for all the access rules. So you could read this at your leisure and see when the deadlines are coming up. This year, we have the grievance system, which is due to be stood up July 9th of 2026. OLTSS is working with procuring a vendor for this. We do have two that we were looking at pretty hard with it, looking like we might be able to select one within the next few days. So we're very excited about that. And then we're going to publish our fee for service payment rates as of July 1st in compliance with the rules I'm going to talk about. And I'm going to talk specifically about the payment adequacy, the transparency rule, the disclosure rule, IPAG a little bit, which is the interested party advisory groups, and then a little bit about the 80-20 rule. Let me know if you have any questions at the end of the next few slides. Next slide, please. Thank you. So the payment rate transparency is one of the access rules, and it means that the state must publish an easily accessible fee for service rate schedule via a website that has a hyperlink, so that's easily able to be found and accessed. That website must be organized for bundled rates. We must detail each included service and its allocated costs so that you know exactly what's in it and what cost components are in there. Rates must be categorized by the population, by the provider type, and by the geographic location. Next slide, please. Continuing with payment rate transparency. Like I mentioned, this is one of the rules we have to comply with this year, or this coming year, I should say. Effective July 1 of 26, the posted rates must be in effect, meaning that the rate has already been approved, and include the date they were last updated. So that publication will also have the date of when the rates were last changed. The fee schedule must be posted within 1 month of the later of the next three authorities I'm going to mention. So the state Medicaid state plan amendment, one authority, the 1915C amendment, which is the authority over your home and community-based waiver, or any new rate methodology amendment effective date. So whichever those authorities have purview over the rates we're going to publish, they have to be published within 1 month of approval of that authority. Next slide, please. The payment rate disclosure is another access rule we have to comply with. And this rule is stating that the state must publish the average hourly rate at least every 2 years for personal care, home health aid, homemaker, and habilitation services as required by this law. And I'm going to talk a little bit more about that on the next slide, please. Okay, the payment rate disclosure says the state must include certain elements in this disclosure. And those elements include the number of Medicaid paid claims and the enrolled beneficiaries who received each service within a calendar year. The beneficiary must be identified by population, provider type, geographical location, and a facility-related cost. And then each service category, the average hourly payment rate, and the individual and provider rates must be organized by category. So this is all going to be organized and disclosed along with the payment rate transparency. Next slide, please. Thank you. The Interested Parties Advisory Group is part of the access rule, and it stated that we must create this advisory group, which already has been put together, and we've had our first meeting. It was a closed meeting, so that the group could learn what their roles are going to be and ask them any questions they want to ask and kind of lay the groundwork. So moving forward, these meetings may be open to the public if you're interested. But this IPAG will advise and consult on payment rates for personal care, home health aid, homemaker, and habilitation services in self-directing and provider agency models to ensure that we're providing adequate rates and provider capacity. The state must publish the IPAG recommendations within 1 month of receipt. So if this advisory group gives us some recommendations, that information will be published for everyone's information awareness on our website. Next slide, please. Okay, the 80-20 rule. So this is another access rule. So the 80-20 rule is a mandate that home and community-based service providers spend a minimum of 80% of Medicaid payments on direct care worker compensation for services like homemaker, home health aid, and personal care. And the remaining 20% can be used for administrative overhead or profit. The DDA currently does not offer homemaker, home health aid, personal care services in the Community Pathways Waiver. The services are categorized as habilitated in the Waiver Authority. The DDA is currently collecting cost reporting surveys from its providers, and other home and community-based service programs are planning to also collect similar cost reporting data to survey from non-DDA providers so that information can be shared with stakeholders and the IPAG group. Next slide, please. The 80-20 rule, the implementation timeline is as follows. So the state must be ready for ready for rate payment reporting. So we have to be ready to report to direct care workers in 2027. And then 2028, we have to actually be ready to provide those reports to CMS and stakeholders. And then in 2030, we have to enforce the mandate. States can grant hardship exemptions and extraordinary circumstances using clear processes and objective criteria. A separate lower performance level can be set in place for smaller providers that meet the state-defined criteria for the exemption. And full exemption can be given to the Indian Health Services and tribal health programs. Next slide. Thank you. The competitive rate analysis is another access rule. This one does not pertain to home and community-based services, but I wanted to share it just for everyone's awareness. This law states that this law requires that states conduct a competitive payment rate analysis at least every 2 years, and it must compare rates for primary care, obstetrical care, gynecological care, outpatient mental health, and substance use disorder services to Medicare rates. And CMS, our federal partners, will provide the CPT codes and guidance for identifying Medicare rates for comparison, and this analysis is due by July 1 of 2026. My office specifically would not do this competitive payment rate analysis, but if it's something this group is interested in, I can get someone who's going to be more involved in that one to present. Next slide, please. Oh, it looks like this one is for you, Ron. I'm gonna turn it back over, and after you're done, I'll take any questions.
Thank you so much, Elisa. We appreciate that. So this slide has a variety of links to information related to the access rule, including some presentations and federal sites related to that. You have the next slide, please. So a few things as we open up for discussions and questions. And again, we're first going to look to see if our people with lived experiences would like to start, with some questions. But related to the information that we've been sharing on the access role, this is one of the purposes and focus area for the Waiver Advisory Council that was put in statute. And so we will be sharing information related to it. Last meeting in November, we shared a handout, which was the visual that the slide Elisa showed in the beginning. It's a great visual to kind of see the different provisions and the times for when they become effective. For those online with us and joining us, if you go to the Waiver Advisory Council webpage, there's a variety of tabs. As you scroll down, there will be one labeled resources, and you can click on the link that actually gives you that visual if you'd like to see that a little bit up close and personal. Related to the provisions, as Elisa says, things are going to come on at different times. And so why is this important to this group? Why are we sharing this information? And so I just wanted to just kind of summarize a few things that directly impact the DDA operated community pathways waiver. So Elisa shared there is a Medicaid beneficiary group that was already established, and so they are looking at a variety of things related to rates. In July of 2026, right, which is about 6 months-ish away from us, then the state will establish a grievance system, which will provide a new opportunity for individuals receiving services through the Community Pathways Waiver and providers to submit grievances. So we want to make sure we're aware of that. And as Elisa has shared, the Office of Long-Term Services and Supports, the department's Medicaid office will be leading that. As we get more information, we'll share that. In addition to, as it gets closer to any links and contact information for the Medicaid office that will be leading that. Also next year in July, rates will be published. We currently, for the DDA operated Medicaid waiver, publish our rates. That is on our website, but there will be another site that I think is being stood up that will include other home and community-based waiver programs or community programs rates, so that you'll be able to see that and compare them with ours. In the future, there will also be some additional information and assessment related to an incident management system. And the access rule looks at the coordination with other state partners like Child Protective Services and Adult Protective Services, so that overall an incident management system is going to be able to support individuals and look at their health and welfare and follow-up actions. Other provisions that will be a few years out relates to the plan compliance, our person-centered plan compliance. This requires, as you know, an annual update, and so it really relates to looking at those performance metrics and reporting to the federal government. Plans or plans of service is one of our federal assurances. It is part of a waiver program assurance, and today Nicole is going to share some information related to that performance measure. Also in the future will be information and reporting related to the waiting list. And so as you know, we support probably about 19,000 individuals in the Community Pathways Waiver, but we also have several thousand people waiting for services. So we maintain a waiting list. And so in the future, there will be additional reporting data elements related to that as we look at the ability to access services and the timing of that. And then the last area that I wanted to focus or just bring up is the quality measure set. And so we have been talking in each of our meetings about federal assurances and specifically the performance measures for the Community Pathways Waiver. And related to that, in the future, there is requirements to states to comply with a standard set of performance measures and metrics. For states that have a program called Money Follows the Person, they are required to implement these quality measure sets ahead of time than the schedule that you had saw. Maryland is a Money Follows the Person state, and therefore we are working diligently with our Medicaid partners related to those quality measure sets. The great thing is, in working with Liberty, our quality improvement organization, and Medicaid, our partners, with the amendment, we updated the performance measures to already include the federal quality measure sets that they're looking at. So as we have shared and will continue to share information and data as it becomes available, we are using some of those options and requirements from the federal government, such as the national core indicators. You may recall, council members, that Liberty has been sharing information about that. So there are specific questions that are noted in our approved federal authority that relate to the national core indicators that align with the quality federal measure sets, So in a sense, we're a little bit ahead of the game as we'll start to collect and see this information. So I know that was a bit of information, but the great thing is we have the visual we'll look at. In the meetings, we'll continue to provide updates as we get closer to some of these time frames. We really appreciate Elisa Jones sharing. And so now I'd like to open up to our people with lived experiences to see their thoughts and discussions and advice and recommendations related to the access rule. So council members, if you'd like to raise your hand, people with lived experiences, we'd love to hear from you and call on you. We have Charlotte. So Charlotte, go ahead.
Hello, thank you, Rhonda. My question was more directed towards the rates, things like that. In terms of the rates, how do they go about finding the rates and deciding what is appropriate or customary for the different areas?
To talk about in general for the access rule, the rates and the publishing of that in terms of home and community-based services, and then I can add some for the DDA.
Yes.
And Elisa, if you're talking, we're not able to hear you. You may be on mute.
I want to apologize. I actually lost internet connection right when you turned it over to open floor, so I did not hear the question at all. Could
Yes,
Nope.
yes.
Go ahead, Charlotte.
Okay, sorry, yes. My question was, in terms of coming to the different rates that are published, what data is used and how are those rates calculated? Because, yeah,
Can you hear me?
so,
Sorry, I'm having trouble. Okay, so how are the rates calculated? So each waiver authority has a rate setting methodology outlined in the financial accountability section. That's Appendix J or I if you wanted to read it. But overall, each waiver has its own way of setting its rates. And part of the IPAG goal is to look at those rate setting methodologies, look at the current rates, look at what it costs to provide that service. And we're hoping that the IPAG will be a group that informs us on our rate setting methodology. In addition to, we also get assistance from the Hilltop Institute, who is our resource for rate setting methodologies. They are the mathematicians here.
okay.
And just
So
to
several
add a little
things.
bit to that, I'm sorry, Elisa, go ahead.
No, I was just going to say several things go into the rate setting methodology. And every time we do a waiver amendment, we look at that rate set methodology to ensure it is what we're doing currently, or if we need to update it in an amendment.
And Elisa mentioned IPAG, and so we're going to try not to use acronyms. So I'm just going to remind everybody, she's referring to the Interested Parties Advisory Group that she started out, which was recently formed, that will be looking at rates from there. In addition to the rate methodology in the Community Pathways Waiver Program, the DDA has a group called the Rate Review Advisory Group that also provides advice and recommendations to the DDA. Other questions for people with lived experiences, and then we'll open it up to our other council members. Okay, Stephanie wanted to share something. Joseph, if you could share the mic with Stephanie, thank you.
EIGHT.
Thanks. I have two questions. Can you explain how the rate review advisory group is different than the IPAG? And then can you also explain with this new group, the IPAG, how those members are being chosen and kind of, you said you've already met. So it sounds like they've already been chosen. Is that going to be something that's public, people can ask to join, or they're hand selected? Can you kind of explain that process?
Yeah, so Lisa, I'm going to share a couple of things, but related to the rate review advisory group for DDA, can you answer her questions related to the interested party advisory group, which is not a DDA group? It's a Medicaid group. We have no related to membership. Can you talk about how members were identified and any additional information from her questions?
Thanks. I'll do my best. So the interested parties advisory group, there was an application process that was communicated through our website. There was an application process for interested individuals. There was the goal to include direct care workers, providers, administrators, individuals who fill different roles to weigh in and bring their valuable input into this group. And that process happened a few months ago. So those individuals were selected far before the actual first meeting, just so that we could ensure we had all the roles filled.
Thank you, Elisa. And so I believe there's a dedicated web page, is that correct, for the interested parties advisory group?
There is, yes. I can talk more about the interested parties advisory group if that's something this group would be interested in learning more about.
Thank you, Elisa. And so think of it as it's a Medicaid-led group. And as per the statute or the requirements in the access rule, they're going to be talking about direct care wages. And as she said, it's going to include a variety of areas, personal care, home health, aid, homemaker, and habilitative services, which is what the Community Pathways waiver programs are. And it specifically says in both self-direction and provider agency models. So if you're interested, I would suggest kind of looking at that membership and reaching out to those if you want to share your thoughts and views. The DDA rate review advisory group only looks at the DDA rates from that, and it's membership appointed, and it does include representation from both the community provider managed model and self-directed services. Other questions about the access rule from any of the council members? Karen.
I guess I would just like to know what your expectations of this council are and how we will support the Medicaid and DDA's work in the access rule and what influence we could have on the implementation of the steps in the access rule.
Yeah, I think that's a great question. I think that we are seeking advice and recommendation on the different areas of the access rule. Elisa, our Medicaid partner, will be coming and sharing information and updates. And so I think the council could help to inform Medicaid in terms of the rules and processes as they're being developed and any standards associated with the different provisions of the access rule. I'd also encourage members to, look into the interested parties advisory group, which is looking at other components of that. And I know Elisa will continue to keep us updated as things move forward, as this provision is really multiple years before it's fully implemented.
Well said. Yeah, that's exactly it. I mean, we would like to keep this group informed of what we're mandated to do via the access rules and our goal of standing these rules up ahead of compliance with real lived life experience before we implement something. So I did put the website to the IPAG, URL to the IPAG website in the chat. So all the information is there about how we procured interested party individuals, who qualified, and what roles we filled.
Thank you, Lisa. And we're just working to get the PowerPoint back on the screen. It appears we're having some interference, and that's the delays with our transition with our slides. Any other questions or comments on the access rule before we go to the next topic?
This is Robert. Sorry, I couldn't. I'm mobile. Can't find the raise hand button. But I think also for any changes, right, that are mandated that need to be operationalized, we'd also look for input on what that looks like from this group as well. Is that correct?
Absolutely. Okay, we're going to go to the next slide, and as we're working to get the PowerPoint moving, and I know council members, we shared the presentation last week with the meeting agenda. Our next topic, I'll just start to cue it up, is related to quality enhancement and improvement strategies. And in October, the waiver recommendation work group for the Waiver Advisory Council sent to us some questions. At our last meeting, we went through several of those questions and topic areas. You may recall we didn't get to finish all the materials. And so this is information that we had last month that we weren't able to go to. And we're going to turn it over to the Quality Improvement Organization to help with answering these questions. The questions came specifically related to the National Core Indicator Surveys. And just as way of background, in our previous meetings, Liberty Healthcare has been sharing information related to the surveys. That included our in-person surveys, in addition to our parent and guardian surveys. And so the subcommittee had shared some questions that that Liberty is going to help to answer. And we also have Ken Capone here with us today, who's going to be helping to address some of those questions. So turning it over to Ken. So Ken.
Hello. The next two slides answer questions from a waiver advisory subcommittee about the National Core Indicators (NCI) surveys. These surveys collect information from people who receive services and from their families. How does the review and use participant feedback from the NCI survey? They looks closely at the answers people give each year. They compare results from one year to the next to see if things are improving or getting worse. If things are improving, they try to understand what helped make those improvements so they can continue or strengthen those efforts. If things are getting worse, they look for what might be causing the problem and explore changes that could fix it. This shares the survey results with the Waiver Advisory Council. This gives the council real information directly from participants so the council can make informed recommendations to the feedback also helps to meet federal requirements. The federal government expects states to check whether services are helping people live good, safe, and independent lives. NCI survey results are one of the ways that shows this is happening. Without this information, federal funding for services could be at risk. Next slide, please. Why ask participants and families to complete the surveys? Both groups offer valuable perspectives. Participants can say whether services support their needs, respect their choices, and help them live the life they want. Their first-hand experiences help ensure services are person-centered and not just based on what the system thinks people need. In some cases, families support the person every day. They experience the service system alongside the participant. Families can point out issues that the participant may not see or may not feel comfortable reporting, such as challenges with communication, health and safety concerns, or problems with service delivery. Their input helps identify gaps that might otherwise be overlooked. How are participants told that a family member is completing the survey? Participants are not told when their family completes a survey. NCI surveys are completely anonymous. This means no names or identifying information are included. No one, the coordinator community services, or anyone else, knows which family completed a survey. Feedback from a family member cannot be linked to the person receiving services. A participant's services are not affected in any way by the answers a family member gives. This anonymity helps families answer honestly and ensures everyone's privacy is protected. How are families chosen or identified to take the survey? Families are selected based on contact information gathered during regular planning. 1. During planning meetings, coordinators ask participants who the important people are in their lives. 2. Those names and contact details are stored in LTSSMARYLAND. Three. Liberty, the organization that manages the surveys, uses this information to send invitations to family members. Only the people identified by the participant, and whose information is in the system, are contacted. Next slide, please. Survey overview. People in Maryland who receive services have been sharing their experiences through NCI surveys since 2022. More than 1,000 people have participated so far. These individuals bring real, lived experience. They know what services help them, what gets in their way, and what could be better. Their voices are brought forward through the National Core Indicators survey results. These results help inform the Waiver Advisory Council and support the Council's role in making meaningful, data-based recommendations to the Developmental Disabilities Administration. Next slide, please. Resources. A link on the slide provides access to the full set of responses from the participant survey, so you can explore the results in more detail. There are also links to shorter summaries from each of the surveys. Next slide, please. Thanks.
Thank you so much, Ken. Really appreciate you sharing that information. And on the previous slide, it showed the different categories or areas for which the NCI survey questions are, including employment, community inclusion and belonging, choice and decision-making, relationships, satisfaction, self-direction, case management, workforce, access, health, wellness and safety, and rights and respect. And so what we would like to do in future meetings is we will have our quality improvement organization, and I believe it may be some peer reviewers who are going to actually share specific data related to the national core indicators so that we can start getting into the different topic areas. So Eric, if you could go back to slide 31 for us. We're going to open it up for discussions, first seeking thoughts and advice and recommendations and questions and comments from our people with lived experiences. But I wanted to put this slide back up because as we discussed, we should think about what area we'd like to focus on first. There's a lot of great information and data in the different categories. You may recall Christina had shared some information with us a few meetings ago. So let's open it up to people with lived experiences, and then as a council as a whole, maybe pick the top three things or top three areas that we'd like to focus on first so that we can focus our future presentation and data sharing with you on that. So opening up to people with lived experiences. Josh. Josh, if you can unmute, we'd love to hear from you. So we'll hear first from Josh, and then we'll go to Emily. So Josh, if you're able to unmute, we're ready to hear your thoughts.
I'm Rhonda, thank you. Looking at the survey overview, I think we should focus on rights and respect, choice and decision making, and then satisfaction. So those are the three I would focus on.
Thank you so much, Josh. Really appreciate that. Emily, would you like to share some of your thoughts?
From can you hear me now?
Yes, we can.
Okay, because I didn't have my mic on. For me, I would like to focus on employment.
Great, thank you. Any other members with lived experiences would like to share comments or thoughts? Okay, Charlotte.
Yes, I also want to second what Joshua said about the choice and decision makings and the satisfaction, as well as the relationships, and community inclusion and belonging. But I also just wanted to ask, in terms of the data, they are there initiatives to help improve the data collecting and possibly the categorizing of the data to improve accuracy?
Yeah, Christina, do you want to try to address that or want me to? So the question is, improve data collection and accuracy. Would you like to share a little bit about how the data is collected, the national organization related to that? And a few things just as a reminder, the resource slide, you can click on the national core indicator today. You can go to Maryland and you can see information and data on all of these areas. So that's publicly available to everybody. And what we want to do with the council is we will pull and go through the different priorities or topics that we identify so that we can further look at and have further discussions about what the data is telling us and how, as Ken was saying, we can use that data to make recommendations, related improvements or initiatives or strategies, so that we can further support the people in our service delivery system in these core kind of areas. So I'll turn it over to you, Christina.
Thank you, Rhonda. And thanks, Ken, for presenting and for your question, Charlotte. So national core indicators, as we've talked about in previous presentations, is a national organization. So many states participate in the survey. And so it is tested to give reliable data that is accurate. And one of the ways that we make sure that that happens is for a certain number of surveys, about 3 out of every 10 people that are surveyed, we have 2 surveyors that conduct the survey and record the person's responses so that we can compare and make sure that both surveyors collected the same responses so that they accurately wrote down what the person told them about their satisfaction with services. So that's how we check accuracy, but we are open to other suggestions if you have them on other ways that we can increase accuracy, and we'd be happy to share accuracy data with you in a future meeting. And then related to your question, Charlotte, about other topics, although the National Core Indicators is a preset survey with certain questions and topics already built in, Maryland does have the option to add other questions that you'd like more information about or set other topics. So that's one of the things that we would love to know from this council is, are there other topics that aren't listed on this slide that you'd like information about? And if there are, please share those with us so that in the next survey cycle, which we'll be planning for in just a couple months, we can make sure that we add those questions into the survey for you.
Thank you so much. Other council members, thoughts about these areas, comments? Hi, so Charlotte, I think your question, you brought it up at the subcommittee about the research methodology. And I did talk to Val Bradley, who is the CEO of HSRI, the organization that oversees this, and she would be happy to talk with you about the research methodologies, as well as Julie Brzezinski from the University of Minnesota, who were the researchers, lead researchers in the creation of this. And they both said that they'd be willing to talk to you. So let me know if you are interested in talking to them about their research methodology in coming up with these, because I know you had a question about that. So another comment that I would make back to kind of what Josh and Charlotte were saying about other areas is we have employment data collected by ICI. I would think that that would be as equally helpful in helping us to look at outcome data. And I'm also wondering about what other outcome data DDA uses besides NCI. So you do have access to this employment data. Do we keep any data on people, what percentage of people are meeting their annual PCP goals? What are PCPs on timeliness? What about the number of incidences, and are the incidences going down? There's a lot of other data that DDA has access to that I think would be really helpful for us in a policy, looking at policy issues. So NCI, of course, is incredibly important from the perspective of people with lived experiences and families. And there also is the staff survey that I know DDA participates in. And I've been involved in the national level on helping to frame some of those questions. But there's also so many other methods and data that DDA has that I think that we could be using for information. So if we could have that together, I think that would be helpful, not just NCI alone. Thank you, Karen. And Karen, before you hand it back, any suggestions on how to share? That's a lot of information, and we can share it. So let's say we took employment is the first thing we're going to do as an example, and we could have Liberty share the NCI surveys related to that. We can have information from ICI, any additional elements, some of the things that you're talking about. That could be chunks of information and slides we go through. Any additional thoughts or suggestions so that we can make sure that the information we're sharing is accessible, and the conversation, so that we can make sure that all members are able to understand the information, just so that we have some dialogue about that. Yeah, I think that under workforce is the staff sustainability. So I think that does Liberty do the staff sustainability survey, or is that's collected by HSRI and then given directly to DDA? So I think whoever manages that at DDA, the staff stability information, and then under community inclusion and belonging, of course, that's what is said in the HRSI or in the NCI data is great, but how about how many goals in LTSS are related to choice and belonging? I think that would be really important to know. So who has access to that LTSS data, and what the what the areas of goals are? Maybe that's not compiled anywhere that way. Maybe that can't be. I don't know. We can compile it as an organization, but some kind of drop down like that. And then I guess demographics certainly can come. There is some demographics kept in LTSS, but so I think that there's important information that can be shared. I like your idea, Rhonda, of if we take employment, that we look at all of DDA's access to employment data, not just NCI, but all of it in workforce, and how many DSP2s do we have in the state that have gone through the Maryland DSP2 career pathway process, things like that. So I think that there's a lot of other places besides NCI data that we are also collecting that. So NCI data really talks about what people are saying who are being interviewed, but DDA has actual data of
of people who are participating. So I like your idea. I don't know if anybody else has any other ideas, but I like your idea of taking a topic and then looking at all the data surrounding that, not just the NCI data.
Thank you. Other thoughts? Josh?
Brenda, this is Josh. I would just have a clarification question. When on the topic here, it says relationships. Could anyone expand or elaborate on what that means? Are we talking about relationships with family, with staff? So what is that? What relationships with who? I'm not clear on that.
Yep, just a second. We're going to give the mic to Christina to share a little bit on relationships. Hi, thanks for your question, Josh. So the survey questions ask about all different types of relationships. So it asks about friends, best friends, families, staff. It also checks in to see if people get to talk to their friends and see their friends as often as what they would want. Those are just some examples of the types of information related to relationships that are collected.
Thank you.
Any other thoughts or discussions for the National Core Indicators? So based on what I heard, in terms of categories, I heard at least 2 people say decision making, safety, satisfaction, can I read my own handwriting? Were the ones, 2 of them that was repeated in, is there, so we could start with those, I guess, and then continue to move forward. Great. Okay, can we go to the next slide? Let's go to the next topic. So if we go to slide 34, and this is going to bring us back to the federal assurances. So we talked a little bit about this earlier. Just a reminder, there are multiple federal assurances for all home and community-based waiver programs. We have in previous meetings reviewed our administrative authority, the level of care, qualified providers. Today, Nicole's going to share some information about service plans. Another reminder that last month we had a handout that's also available on the website under the resource tab. That is a few pages that list all the assurances, all the performance measures, and the data sources. So that's a great resource material for everybody. There's the link on the slide here. And now I'll turn it over to Nicole to talk about service plans.
Thanks, Rhonda. If we can go to the next slide, please. Okay, so on the slide, we have listed the service plan performance measures that are in effect from October. We are looking at now, we're currently in FY26 quarter 2. So these are the performance measures that will be captured. So performance measure number 1 is looking at the percentage of participants who report their service plan includes things that are important to them. Performance measure 2 is looking at service plans that addresses identified risks. Performance measure 3 is looking at service plans that document exploration of other non-DDA services. Can we go to the next slide, please? Performance measure number 4 is looking at plans reviewed and updated before the annual plan date. Performance 5 is looking at percentage of participants who report their staff come and leave when they're supposed to. And performance measure number 6 looks at the percentage of participants who report they helped meet their service plan. Next slide. Okay, so to close out for fiscal year 25, the service plan performance measures. So as we've stated previously in other meetings, the requirement is that DDA as a whole needs to meet 86% compliance for each performance measure. As a whole for FY25, we were on an average of 97% compliant with all service plan performance measures. Some performance measures did not meet 100%. So some of the things that we continue to work on with our regional offices and our coordination of community services is discuss any challenges or barriers in submitting person-centered plans timely. Many times what we're hearing is that it's difficult at times to get in contact with participants or their family members. Um, Sometimes the person-centered plan needs to be rescheduled for one reason or another. Team signatures are not always present on the signature plans. And then at times we're also missing documentation when the PCP is being submitted. So at times that we're missing the family and staff form, a behavior support plan, or even at times the health risk screening tools. And sometimes they're just not being submitted on time. So those are some of the barriers that we continue to see with person-centered plans being submitted. We can go to the next slide, please. So I'm going to open it up to people with lived experiences. So just kind of asking, does anybody have any suggestions on how DDA can improve with obtaining team signatures and gathering all the required documentation for a person-centered plan? Charlotte?
Thank you, Nicole. Yeah, I would just suggest that an area to really focus on is just kind of the job conditions for the different people working with the participants. So CCS support brokers, the individuals that are kind of working on all that, making sure that their working conditions are good, that they have the ability to bill what they can and give everyone their best time and effort. And I think focusing on those areas would help improve the overall functioning and operation of you know compliant documentation and person-centered plans.
Thank you, Charlotte. I'll definitely take that back. Anybody else have any questions on the council?
Click 9.
Feedback?
Click 9.
Is there a operation guide for participants, like, so that they know, like, 90 days out what to expect? Or is that part of the CC? I know it's part of the CC's role to help them with that, but like something just specific, because I think a lot of times it seems like what's happening, particularly citizen self-direction, is some of the stuff seems new to them, like nursing care plan, that hasn't been in place for that long, but so that they can sort of get their ducks in a row ahead of time.
Yeah, Matt, that's a really great, I think, point and something that we should look at and further develop. We do have the person-centered planning manual that's been on the website for some time, so we're working to update that, at least align with the amendment. We also had talked about with the waiver recommendation work group about the self-directed services orientation. And at that time, we talked about some of the advice was to really look at creating orientation overall, not just for one model versus the other. And I'm thinking that might be another great opportunity to talk about like a vignette or a scenario related to the person-centered plan and the components. We are working on a variety of strategies and tools, some pretty exciting ones that I've seen lately that may help, so that we've got visuals and small clips to help people and stakeholders overall. So that's a great idea as we look at that. The other thing we've been looking at is years ago, we issued a document that talked about roles and responsibilities. It was like participants and families and coordinators of community services, support brokers, providers. And so I know the team is looking at that to update that too. And maybe a checklist also that would kind of help the process to go forward. Because really it's not one, there's multiple people involved in a person-centered plan, right? You've got whether it's an applicant new to the waiver program or a participant that's doing their annual plan or a revised plan. So really, they should be driving it, absolutely. It's helped to be facilitated by the coordinator of community services, but there are so many team members involved, whether they're families, representatives, providers, support brokers, other members, and they all they play a role. And depending on which model, then there's additional roles, sign-offs, submitting, accepting the service referral. So there's a lot involved as we come together to support people. And so, an opportunity to increase our communication, but I think also an opportunity to look at the complexity of that to see if we can simplify that. Great. And Matt was saying he was thinking about a one page or so. If someone was saying if you're going to ask for personal supports, this is what you need to have, or personal supports enhanced. So thank you, Matt. That's a great suggestion.
So I had a comment and question. Or more comments, I guess. I definitely think a one pager for both models for what paperwork is required, like at least the minimum paperwork, especially with the changes on October 6th. So like employee handbook and just adding all those things, just having a checklist that gets sent out to each team member, not just the CCS, would be really helpful. And then I feel like there's a breakdown. Oftentimes there's a rush at the end for the final PCP meeting for signatures. And what I'm finding oftentimes is I'll show up on a virtual meeting and the participant is not there. And that happens more often than not. And I have to say, hey, where's the participant? And then that's usually where the family and staff form or the participant agreement form is getting discussed. And they're not usually often like, where are they? They need to be part of this conversation, so I think there needs to be more of an emphasis on that as the CCS's role to really make sure that they're having that in-person discussion with that person to make sure, that when they're doing those forms, that is what they want. They kind of get left out of that is what I've been experiencing. So.
Yeah, thank you so much, Stephanie, for sharing that. I know we have Teresa here who's going to share some thoughts too, and we have Jamie Stoner on the call. And both of them are very active and will be taking stuff back to the coordinators of community services as they have their business models. But yes, participants should be at the meeting, and that should be the specific focus related to that. Signatures is stuff that I know a lot of things are kind of being done virtually, but yeah, when you're talking about critical things like the participant agreement and things, the critical is a must. Teresa.
Yeah, thanks, Rhonda. I wanted to say thank you for pointing out appreciating the complexity of actually completing one PCP because of all the numerous players that are involved. And from our data suggests that 40% of reasons why we might be late as a CCS is because we're waiting on the other documentation from different providers. And so I don't know if there's anything DDA can do to messaging to providers related to when the behavioral health plan needs to be submitted that's done on time. And so, but again, it's very complex. There's so many players and to get it done. It's a very important one. So that's just one of my suggestions. Jamie might have something similar.
Yeah, I really appreciate that. And I'd like to ask our other council members to help take that message back. I know we have new membership representing the Maryland Association of Community Providers, and we also have some providers in the room. So asking that if you could also help echo that. It's really important. We actually, we all are driving towards the ability to provide access to the service in addition to what the access rule we talked about. So we really want plans to be person-centered and be able to go through the process and unauthorized so that there would be no disruption related to that. So thank you for sharing that. And Jamie would like to share. Go ahead, Jamie.
Hi, sorry, I am traveling today. Can you guys hear me okay?
Yes, we can.
Okay, thank you. I missed a little bit about what Teresa said, but I did want to say that I will take the feedback regarding people supported being at the meeting to the CCS COP and make sure that we're communicating that because as stated, it is critical for the person to be there and be present. The other thing that I had just wanted to ask, I think Nicole in the beginning, you talked about some barriers and some reasons. Can you share a little bit about where that data is coming from and maybe an opportunity for us to see what the maybe top 3 or 5 barriers are being reported are. I think again, with members on the subcommittee, that might be something that we could look at.
Yeah, great question, Jamie. A lot of the feedback is coming from regional offices, and when meeting with CCS agencies on a routine basis, that feedback is coming back. Also within LTSS, there's activity notes. People are documenting the reasons there also. So that's where some of this information is definitely coming from.
We put the reasons back on the slide, so these are the things that we're seeing. And just overall, I just like to say that there's been a lot of work and great progress overall with person-centered plans. 97% compliance with getting plans through and on the annual process is amazing. And so as we look at these additional things, as we try to, improve, we always want to go up, but 97% is really great. Any other comments? Yeah, we're looking for council members.
So this is Karen. One of the things that I know, we created a system when we entered at LTSS, we created a system that backed us up the 90 days that we talked about. And so we have this whole system where we do our internal pre-planning and get all the documents ready. We also just learned that one of the great things that we've done, heard this from a colleague of ours, is as a provider, we upload the documents into LTSS because there's such high turnover in the CCS agencies that we work closely with, that documents end up getting lost a lot. And so rather than us sending them to the CCS agency, we're actually just uploading it now. And that wasn't something I think that was ever a part of the process, but I think that would be helpful for providers to know that they could just upload them there so that when there is turnover, they are sitting there because emails are gone and so on. So I think that would be a great addition. But I think the other thing we found is because of the back and forth that's happening with plans at DDA, is that CCS agencies are feeling the need to back up even farther than the 90 days sometimes. And so we have a number of CCS agencies that we work with, and so now we're starting our planning at 90 days, and they've started at 120 days. Well, now we're like 6 months ahead of time, and we're barely into a person's plan year, and we're looking at next year's plan. And so I think that improving the system of approval at DDA with the back and forth, so whether that's additional training for CCSs or providers about how the plans are written, would allow us to get back to that 90-day mark rather than going all the way back to 120 plus.
Yeah, Karen, thanks for sharing that. A couple comments just to share information. I think in terms of provider uploads, you're right, that was a system enhancement. And that would be something that we would ask all providers to help support the whole process. So if you've got your behavior support plan, you've got your documents, upload them. Really, we want the team to come together and share that information. And so that's why it was added as an enhancement related to that. In terms of the 120 days, really the person-centered plan can be developed and started in the system at 90 days, is my understanding. There's a lot of planning or pre-planning, but there's also the quarterly monitoring related to that. And we're happy to kind of share some additional information related to that. For the approval process, really, we do clarification requests. We're looking at doing 3 clarification requests, and what we would like to do is make sure that, with the suggestions and recommendations today, we could look at more one-pagers and documentation and what to expect to be requested, because then collectively they can be on the front end and we wouldn't have to ask for the clarification. We do have our policies and our manual, and we're partnering with our coordinators of community services and providers. Really, the requirements are in our policy and stuff and our actual waiver application, but we'll look to get some more tools so that people are all aware. We can try to streamline that because really the information to an extent is out there, but maybe we should do it a different way that's more accessible so that we don't have to have the clarifications at all. Stephanie.
A pattern that I've been seeing the last kind of since FY 24, 25, and 26. A clarification will come back, and then you answer that, and then another clarification about a completely different thing comes back. And then a third one might come back. And so the question is, they're not related. So why during that first round couldn't all clarifications have been addressed on day one? Because now you've extended, well, you have 20 days and you have 20 days and you have, so you get into like 3 months. It's not uncommon. I have like 5 people I support that, you know, had clarifications going on for like 4 or 5 months. They're halfway through their plan year before they actually have a PCP that's effective.
Yeah, thank you for sharing that. And I know, you know, we're working really hard and our regions are looking at that process for our review of plans and looking to do clarification. So there's been a lot of great work and effort so that all clarifications are issued at one time initially. We do find that when we ask for clarification, sometimes the plan that comes back to us not only addresses that clarification, but makes other changes within the plan, which then could be non-compliant or supportive. So then that triggers another thing. So some of that is the reason for that. But really, we're committed to the 20-day process and not having an extension. So we're looking to have all clarifications and decisions within 20 days. So that's an effort that we're looking at, and the regions are implementing, and we will be decisioning plans within that time frame. Any other questions from council members?
This is just for my knowledge. For people that are self-directing, do their support brokers have the ability to upload behavior plans and other things like that directly as providers do for their participants?
No, at this time, support brokers are not able to access or upload information. The uploads that Karen's talking about is on the provider portal side, and that's the way that they bill. So it was an additional functionality. As you know, support brokers are paid through the financial management counseling services who have their own systems. So we can look at that in terms of support brokers and providers and those opportunities that may be available. Great. Let's go to our next topic. And we're going to talk about subgroups. So Eric, if we go to slide 41, please. And as we go to slide 41, a couple things. We're going to turn it over to Charlotte to share information about people with lived experiences and their work group and discussions. And then we'll turn it over to Charlotte and Karen related to the waiver recommendation work group. And we did get another email the other day that we replied to, so happy to pull that up and review that if that's what you'd like. And then lastly, just a reminder, at the last meeting, there was some discussion about establishing another work group, the self-directed work group. The council had a lot of great discussion last month, and it was some concerns are maybe not needed, and that I think was a decision related to that, or a vote was held for further consideration. So Charlotte, turning it over to you for people with lived experience.
Thank you, Rhonda. So this past month, the lived experience group tried to meet more often so that we could kind of give everyone chances to kind of discuss their own personal experiences at their own pace and time. And it's very regular. So we are going to try and move to a more regular meeting time. So starting January 7th, we will meet every evening virtually on Wednesdays at 6 p.m. And I will send out to my the lived experience group members the link. And even though it is going to be for the lived experience members, if anyone who is not a lived experience member would like to attend a meeting, they can reach out and to me, and we can arrange that. It's for them to attend a meeting. So that's the first thing I would say. The lived experience group would like to respond to DDA's attempts to kind of help slow the process going on and to kind of help make the information to access and everything easier for our members with lived experience group. And we appreciate the initiative, and we just hope that it, slows the process for us, but does not slow down the progress. We still want to make sure we're progressing in a timely manner, since many of the issues that our participants are having are very time sensitive, and so we just hope that it doesn't slow the process more, or the progress more. Um, one of our requests that we would like to submit is whether or not we could have a future meeting be attended by legislation, and to maybe have a type of panel or Q&A style meeting, so that we can have more of a direct connection to the individuals making decisions. And yes, so that was everything we had on our update today.
So much, Charlotte, and we'll open it up for any other comments or discussion for people with lived experience in the council. Related to the request about having legislators attend, just to let you know that the law that was passed last year includes 2 seats from legislators. So there are representatives from the House of Delegates and the Senate that are appointed or to the council. So we do have them associated with the council, and I know that they are actively taking the information for consideration. I'd like to open up if we have any other people with lived experiences or council members that would like to comment or ask questions. Okay, we want to go to the waiver recommendation work group.
Wake up.
Hi, this is Karen.
Sure,
Thank
Rich.
you. Charlotte, I'll
Click
start.
40.
I have the email in front of me. So we had emailed Rhonda and Nova and asked them to respond on a couple things. The first was the self-directed health insurance plan reporting form, which I thought we were going to discuss today for some reason. I don't know why I thought that, but and we had some very specific questions about who completes the form. Is there going to be guidance and training on it? And what are we comparing it against? What are we comparing what's on that form? It's a pretty laborious form with lots and lots of questions on it, and we wondered if it could be shortened and easier to read and review, so that it is in more plain language and ability for others to complete that. And so I would, is that something, Rhonda, that you're going to bring back to this group at some point for discussion? Or we're ready to talk about today, but we wanted you to share your. Okay, that's the first one. The next was our recommendation that that while I know that there were financial reasons why the day-to-day administrator, as well as CMS guidance around day-to-day administrative policies, that we believe there has been significant impact on people with lived experience around the reducing of the day-to-day administrative hours. Our recommendation to DDA was that you gather a group of people with lived experience who have been impacted by the change in the day-to-day administrative policy, and do a open forum with them. And so you said that you thank us for the recommendation, but we're wondering if that is a recommendation you're going to take, or if you could report on that in the future. Also, we asked that the putting together of this agenda, that we work together, and rather than us just reporting out, that we actually feed to you information about what we've been talking about to guide this this agenda for this meeting. And then I also want to thank you so much for acknowledging the opinions and ideas of people with lived experience, so that we take those into consideration as we talk about policy, and that after a topic is introduced, that we then move to people with lived experience to tell us about how it impacts them and so on and so forth. And then we have maybe policy discussions about it or others, but we get that perspective first. So I really appreciate that the cadence of this meeting has reflected that. And I would turn it over to Charlotte to say, Charlotte, do you feel as though that that cadence
6-9.
worked out well today?
Can you hear me? I'm sorry. Okay. Okay, thank you. I'm sorry, Karen, I was fiddling with my thing. Can you repeat your question, please?
Sure. We had talked last meeting as well as at the our subcommittee meeting about making sure that the voices of people with lived experience is heard first after a topic is presented. And we did that in last month's cadence, the meeting cadence, and then we did it this month. And I just wanted to make sure that you feel as though it's meeting the outcomes that you were looking for, so that the experiences and opinions of people with lived experience is considered and put forth before we start talking about policy in other areas.
Yes, thank you. So we have discussed it, and we know that, it takes time to, create the new systems and protocols for things. So in terms of the council feeling like the focus is input from lived experience, we feel like we are working towards that, but we would not say that we feel that we are there yet. But we do appreciate the efforts, and we hope to continue moving forward and evolving toward holding these meetings. We have also requested that lived experience members would speak first at the beginning of meetings before DDA, and so we're still waiting to see if that will be allowed for future meetings.
Thank you, Charlotte. Thank you, Karen. So a couple things before we talk about the health insurance reporting form, just to go over a couple of the other things. Thank you for sharing the waiver recommendation work group. I'm thinking maybe you guys met on Monday and did that. Karen let me know when I saw you on Tuesday related to it. So thank you for that. We looked at that, and I sent the email on Wednesday to get back to the group immediately. So a couple things. We'll talk about the health insurance reporting form and the why and what we're doing. And I have Christy Colbert here who will help us kind of go through that. For the day-to-day administrator and the nursing support services, again, we just got those recommendations, so happy to take that back and think about that, to look at that perspective. For agenda collaboration, so a couple of things we shared in our response to you is the council purpose, and so there's set things that we are charged to go over, and so that's what the meeting agenda is kind of based on. But those areas include like service delivery and access, and so that's where I think we can get into more of the discussion about different topic areas. We had created a contact form similar to what's used in some of our other advisory groups, where members could put questions or suggestions for agenda items. So we included that in our response. We'll make sure that that's included in all our emails that go out to the council members. So you'll get that every time, that if you have an agenda item, you can absolutely put that in there so that we can take a look at that. We asked that the submission of those items should be 2 weeks prior, just so we can be prepared. As you know, we're making a commitment to get information out ahead of time. So last Thursday, you got not only the agenda, but the PowerPoint. So giving us 2 weeks ahead of time will help us so that we can look at that and put together information. So we really appreciate that. And we are excited about, the additional discussions and really prioritizing people with lived experiences in all the discussions as we go forward from that. So I'm going to kind of queue up the health insurance form, and Christy, if you want to come up and join me in case we need to, I need to kind of tap into her, but a couple things that are going on related to that, and we shared this in the email response to the group, that self-directed services includes the ability for participants as employers to offer benefits. And in the self-directed service delivery manual, we have issued information related to reasonable and customary benefits. You may recall we brought that manual to this council several months ago related to that and had additional information in there from that. In terms of health insurance, what we have found is that the waiver talks about the ability to have benefits for employees. And what we have found as we work with our financial management counseling services providers is that individuals are seeking reimbursement for health insurance plans that are not just for the employee, but are including spouses, other family members, and in some situation, actually participants reimbursement for health insurance costs. Obviously, we're concerned about that because it's not in alignment with our federal authority. And the intent is really just to be able to provide the opportunity for health insurance benefits for employees. In the manual, we did outline the guidance and clarified what kind of policies really should be looked at from our perspective as we were thinking about and the benefits of that process. And so this health insurance reporting form is an opportunity to gather information and give us better insight in terms of the different types of policies. So there are drop-down questions that says, hey, are you giving a policy and is it for the employee? Does it include the employee's spouse? Is it family members? So really the opportunity for them to check the different types of policies so that we can have that. And working with our financial management counseling service providers, they don't have that information either, policies and those details. So we need to make sure for our financial accountability and due diligence that we are making sure that reimbursement is appropriate because we absolutely want to support that for employees. And so in order for us to have more information as we look at further supporting the transition of policies and strategies related to that, we need additional information. And the best way to get that information, we thought, in terms of talking, partnering with our financial management counseling service providers, was to create a reporting form so that we can get that information and then be able to look at it. In the manual, we did say that we would support people transitioning who were not in alignment with the guidance that we had put out in October 2026, and then our 2025, October 6th, 2025. And we have seen, and people are transitioning, people with their annual plan, they're kind of making updates related to that, and others are kind of waiting for some additional information. So for us to be informed and have better insight, this is why we created the reporting form related to that. What we are asking is for the council's suggestions. So if you have suggestions about different language, please share that, send that to Christy and myself so that we can look at that. We also met with our financial management counseling service providers yesterday, asked for the same thing from them so they can get us that information. What we can do with that based on those advice and recommendations, then we can make some updates to the form and then we'd like to share it. What we will do is we'll create, a webinar or a short little summary kind of document to talk about what it is and how to complete it so that people will know that. And we have noted that it could be completed by anyone. It's not necessarily a particular person, but that person completing should have authorization from the participant as the employer and would need to know that information in terms of the policy and stuff so that we can have that. Again, we want to support employees and the participants in terms of that benefit option, but we do not have insight in terms of what's going on. And it has been brought to our attention that there are reimbursements being made for things that are outside the purview of an employee benefit. Teresa.
Rhonda, thank you so much for that additional context. In my opinion, I think when this subgroup met, we weren't clear on the reasoning behind the new form. And so it's difficult then to ascertain why is this new form being developed, that type of thing. And there always, I'm sure, is a good reason, but I think that when the ask is made, perhaps providing a little more context, I think would be helpful.
Yeah, thank you so much.
I didn't see the form until Monday, right before our meeting. So I kind of processed it this week. And one of my big concerns, I'm a support broker. So I've helped multiple people get and need insurance. Every single person that I have helped has not had any insurance. So they go to Maryland Health Connection, right? So I believe all the people that I have, I'm supporting and helping their employees get insurance are doing it the right way, right? They're only getting insurance for themselves. But there's an open enrollment, just like with any insurance. So unless they have a life-changing situation, there's a limited time period. They've got to get in, right? And it ends January 15th. So you have that time restraint. Then you're telling them as an employee, I can offer you this benefit, right? I don't agree with some of the changes that have been made to it. I think I've written that to you guys. Dental vision is a very common, 95% of all small businesses across the country, and all data I have found was offered. So the fact that dental vision is not offered, I struggle with that. I struggle with the loss of employer authority to kind of help make that decision ahead of time, because I feel like this strips that away. Now DDA is making that decision. But if you're going to move forward with this, that process, right, it's going to take weeks, 30 days, 20 days, whatever that is going to be. The person has to go to Maryland Health Connection. They have to commit to a plan. They have to say, I'm going to pay. This is a reimbursable. This isn't a benefit like you get as a provider. So they're going to sign up for that. They're going to commit 200, 400, whatever kind of policy they choose. They're going to commit to pay that in advance. They're going to wait for you guys to say yes or no. If you say no, they've now signed on to this commitment. I don't know exactly what that looks like in all cases. They're going to pay that out of pocket ahead of time in hopes that DDA grants them their, golden ticket that yes, you get yours covered. People are not feeling very confident right now. A lot of things are getting denied, so there's not a lot of confidence out there. Then they have to wait. They have to pay it. They have to get their reimbursement. Is based on, now we're being required to show a bank statement. Your bank statement doesn't show your payment oftentimes for 3-4 weeks. So by the time you add all this up, it's taking people 3 months to get paid for something they paid for 3 months ago. And then now they've taken on this. And these are people that are barely making a living wage. So I'm concerned about that added burden that this is going to add to. And then by the time you get it approved, are they going to be within the open enrollment window? So I have a lot of concerns about the process.
Yeah, so Stephanie, what we're trying to do right now is find out what's going on, right? To have the insight. And so we're asking people to tell us what type of plans they have. There is the open enrollment process. We did share that information in October in terms of, any new policy and things that they're looking at. They should be looking at those guidance related to that. So if someone goes on Healthcare Connection and they're selecting a plan that's only for them, then that's going to meet the standards, right? That's going to meet the standards that's currently in the manual related to that. We can look at the process for other individuals in terms of new employees and kind of going down as we get experience from this process that we're doing. We're looking at transition plan. And so for those that are in that kind of open enrollment process, we know that, we want to help to support that and then them transition after that open enrollment process. So we're looking at that. I don't know about the bank statements. I don't know if that's something from the FNCS requirements, but I'm happy to look at that. With the reporting form, we're just asking for what's the type of policy? Is it only for an employee, employee spouse, employee family, other people, and then what it is so that we can have some insight in that. We are also doing national research. We've looked and reached out to Applied Self-Direction. Not a lot of states offer benefits and these type of things. So Applied Self-Direction does have a report out that's on their website that if anybody's interested in looking at. So we're looking at what we can do, ensuring our financial accountability with these Medicaid dollars and our federal authority, which says employee benefits for employees. And so we're looking at that. There has been reports of reimbursement for things that are outside that purview. But thank you for that experience. Christine can follow up afterwards and make sure we have that. We're happy to look into the bank statement situation you're talking about. Yes, Beth.
So my question is, when is this plan supposed to be completed? When is this form supposed to be completed? Is this completed one time in a person's annual, when they're doing their annual plan? Is this form completed any time a reimbursement is put through?
Yeah, so again, we're taking your input and advice related to it. What we're thinking, it would be part of the annual plan process, so that it would document what the plan is and what the reimbursement is, so that we can kind of, yep, that's good to go. That will feed into the financial management counseling service provider, so they'll know that, yep, that plan was approved. And as the invoices come in, then it can be just paid and go forward from that. It can be done at any time because I just hired Nicole mid-year and I'm going to offer her insurance. So anytime you're going to do a new one, but we're looking at it to be annually or whenever there's a change or a new employee.
So the feedback that I have is just similar to Karen's. It asks a lot of questions, and I don't know that all of this information is necessary on this form. And I can give you my marked up things. But I would suggest right up front, pretty much the first question after the name and all that kind of stuff is just your question about, is this plan the employee only? You know, is this plan in the employee's name? If it's not, stop completing the form. Are you seeking reimbursement for anyone other than yourself or your employee? Then stop completing the form. Like really, because it doesn't get to those questions till closer to the end. And so you've already provided all of this information. You're not going to get it reimbursed anyway. So but I'm happy to give you my.
Yeah, thank you so much. And so I think Beth, and think of it in two different situations or two different purposes. Okay. One would be kind of the approval process, which is what you said. Is it employee only? Yes, here it is. Boom, it's great. Or if it's no, then that it's quick yes or no kind of thing, right? But what we're trying to do is gain more insight in terms of the plans that we don't know and to look at how we can support as appropriate a transition plan. Some things should not have been reimbursed because they were not for employees. So we're trying to, with this initial form, is collect to know what's out there and to be able to have data, right? We talk about data for the council. We wanted to know what the plans are that are being reimbursed, because for some of those, we're going to have to go back and look at the FFP and give that back because that would be not appropriate from an audit perspective. So this initial request is to find out what are the different plans and what they're doing. And then for us to be able to have information that we can have data on and to look at for any corrective actions there. And then as we go forward, it can be extremely simplified, like you're talking about, for everybody else, because they would be in line with the process.
Again, I think some of this also can be addressed in the increased training that's going to happen for families, participants, and support brokers and all the team members. I think that just needs to be something that's emphasized there of here's what the regs are right now. And I just, for those in the provider model that are listening in, this is not like an additional funding that comes into ours. It's part of the rate. So I think that gets lost sometimes in these discussions that the individual, the participant, who's the employer, has a choice of how to utilize their rate. And that, again, I feel like is being lost with all of these rules. They should be able to decide my employee doesn't need health benefits, but they need extra PTO, or, an employer, somebody who runs an agency has that choice to choose how they utilize that rate. And they don't have to run to DDA every single time they want to say, I would like to offer vision coverage. They can just make that choice as that provider. I think the participant, as the employer, needs to have the ability to decide what is going to help me retain my staff. And every staff member you hire is different. So a benefit package for employee that works Monday 9 to 5 might be different than their employee that works evenings and weekends because they have a different need. And I feel like we're losing that ability to have that individual perspective.
Yeah, thank you so much for sharing.
I have a follow-up question, Rhonda, to what you were saying about the purpose of this form. Are you suggesting that participants who currently provide health insurance in their current plan will have to complete this form now, or when they renew when their plan renews?
Yeah, we are looking to get information now because we have no insight in terms of what plans are and what's being reimbursed. And working with our financial management counseling services, they have no data related to the type of plans that are being done.
So are you suggesting that the participants' employees who are currently getting insurance, as it was written in their plan, may not be able to continue paying their employees health benefits for their current plan cycle?
No, that's not what we're saying. What we're saying is we're gathering information Because as we put in the self-directed services manual, that for those that weren't in line with the guidance that was issued, that we would have a transition plan. So in order to create a transition plan, we need to know what's the different situations and scenarios.
Wouldn't the CCS though be responsible for telling the participant that, I'm thinking that it's really clear that this is a benefit that many of the participants currently offer, and that will end as their new plan renews. It's not going to be an option. So I guess I'm questioning why we're asking them to do this work now, to submit all this documentation, when it's not going to make a difference in another 3 months because the health plan is going to go away, right? If I don't
So
understand
if
what a
I'm,
transition plan is, other than just saying you're no longer going to have health benefits when the plan renews. And that to me seems like a responsibility of the case manager to inform the participant that that change is coming. I don't see, Matt, maybe you can help me as the FCMS. I mean, if it doesn't make a difference currently how they've been paid, whether they're on somebody else's plan, whether they've been, paying for somebody else. I mean, it's not going to make a difference. DDA has said that wouldn't change until the person's plan renews. Why then go to this extra work now? Just,
if I may,
Yeah.
what we are doing currently is what we typically would call an environmental scan to get a sense of what's going on from a benefit perspective currently to inform how we put together the reasonable and customary benefit guidelines that will, eventually also be socialized with the Waiver Advisory Committee. As Rhonda mentioned, not even our fiscal management counseling service agencies um, have that data available. We're finding out many times just through happenstance, through increase in things, that there are some plans that fall outside of what is approved in the federal authority or the community pathways waiver. And so, we don't know currently how many participants who are serving as the employer are offering their employees dental or vision. We have no idea of how many are, referring their employees to the health insurance exchange, the state's health insurance exchange, versus using a vendor directly, which typically do not have an open enrollment period. So we're just trying to get a sense of the current landscape to inform that process. This form, as you see it currently, is not a form that will be used moving forward. We'll work with our fiscal management counseling service agencies to ensure that whatever process they put in place to ensure that plans fall within the reasonable and customary benefits is streamlined and does not create a lot of administrative burden. But at this point in time, we just don't know what is going on from a benefits perspective. And so this is going to help us get there. And some of the automated workflow, I think, not being in the room, I forget who was talking about it. Like, if you answered no, then that kind of ends the survey. Once we have something back, we're going to have a print version of the survey available, as well as an electronic version through SurveyMonkey that will help to support that workflow to streamline the process.
So I had a question. First, a clarification. This form is for information collection on the DDA's part. Is that correct? Just to
But
get
as Robert just said, right,
to
an
get the
environmental,
landscape of what's out there.
right.
This form doesn't read like that. It reads as if it is almost like an application for approval. And I think that it's important that the DDA recognize all of the changes that have been going on within the self-directed model, and how the context of all those changes and then adding this can create confusion around the purpose of this. And so I would say it would be important to go back to the drawing board and look at how this form is worded,
and how this form, what is collected within this form, because if it's only to get a lay of the land, I think that it's missing the mark from that perspective, and it's really, it kind of reads like, if you want to provide health insurance, this is the first step. And so without this, it won't be approved. And so I think it would benefit from that change.
Yeah, thank you so much. And so appreciate that. That's why we shared it with the council and the FMCSs, the financial management counseling service providers. Going forward, the second kind of process in terms of whether it would be approved, the yes or no, would be where we would going. So it was kind of combining it. So I just want to be respectful of time. It's 3 o'clock. And we'll take Teresa, then we're going to open up for some public comment. And then we would ask members to please share with Christy and myself any suggested language that you would like to make. We'd appreciate that so that we can take that into consideration. So Teresa.
So thank you. I just wanted to echo your comment about the purpose of the form, and it's clearly does not read to us as an environmental scan or information only or initial request and nothing else with it, right? So because I think there will be an upset, I think, as well as who's actually filling out the form and how the CCS might be helping the families fill out the form. There's just the communication around it, as I mentioned earlier, especially related to context, I think we need some improvement. The other thing too, and I'm not asking for an answer right now, but what I heard you say originally was that we're seeing where participants are including family members of their employees on the health plan and that they're paying for that. That seems to be the problem you're trying to solve for. So how can it be simplified to solve for that problem directly rather than creating a whole environmental scan? To what end? And does it really, what else will you do with that information? I think it's going to create a little bit of uneasiness and hysteria when this comes out.
Yeah, so thank you for sharing that. Again, I would say two things. Yes, the environmental scan to see what is out there, so that then we can take remediation actions related to that. We don't know what's out there, what's being paid, that really we need to ensure is corrected and reimbursement back to the federal government because it's not within the scope of our authority. So that's number one. And to do that, we need to know. The second part would be going forward. So with the plans, because there's no process currently in place, no insight that we've been able to get from our partners, then it would be that kind of more simplified process so that we can look at that and confirm it. So Matt, why don't you, and then we're going to open up for public comment because we ran out of time. Go ahead, Matt.
I was just gonna say, I mean, the information from us means that when these new requirements came out, we started collecting plans and stuff from people, but it's not in any standardized format. So there's nothing we could provide to DDA to say that, this number of people will do it this way, whatever. So, so this was an effort to standardize that across all FMCSs. Also, I think it's also more, and I don't want to put words in DDA's mouth, but I think it's also more of an effort to identify people who receive health insurance through another job, and the reimbursement is simply for the employee share of the health insurance that their other job provides them. So it's not what you're talking about, Stephanie. It doesn't seem to be what you're talking about. That it's more just that it's not common for an employer. So when we talk about reasonable customer, it's not common for an employer to give someone a stipend for their other job's health insurance, right? It's common to say, I mean, that's what we do with our employees. What most employers do. We'll say, we'll cover your health insurance if you want. If you don't, great, it benefits us. There's some average usage. That's how that works out. In this case, there's a lot of people who are receiving that. And so I think that it's more of an effort also to identify that because that wasn't prohibited per se in the past and wasn't always clear. What are we reimbursing? Are we paying for the health insurance so that this employee can be retained by this participant? Or are we just giving away money to people who already have health insurance? And if this stops, they won't lose it. They'll just keep paying what they already knew they were going to have to pay.
So as an employer, I totally understand what you're saying. What we do is there's an attestation that employees sign that basically states, I do not have health insurance coverage with other blah, 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 blah. I don't know why that couldn't be done here as well. It really simplified the matter tremendously rather than going through this huge effort of trying to, what seems like to control, what I think will be perceived as trying to control what they are offering.
so much. We're going to open up for some public comment. So if you want to put a question now in the question box, I'm happy to read that. Or if you'd like to raise your hand, we'll call on a few people. The first person I see is Rick Broyles. Then we'll go to Karen Smith.
Yes, I just wanted to make the comment that the support broker that spoke mentioned about the FMCS is wanting all kinds of extra documentation all the time. And I was just going to second that if you have an invoice that says it was paid, that's to be sufficient. You shouldn't have to provide a credit card statement or a bank statement and all this other stuff, because then that just leads into even more privacy stuff getting out there. And I personally have to sit and black out more than half of a credit card statement just to send it in every month. So that was just my thoughts. That why is there a redundancy in paperwork that Maryland state law does not even require?
Thank you for your comment. It looks like Paulette.
Yes. Am I unmuted?
You are. You have.
Oh, okay, great. Okay, thank you. Yes, I just want to echo about the discussion about the health insurance. It would be nice to also let those of us who are supporting people that are self-directing to just let us know that the insurance is supposed to be only for the employee and not for other family members. And then we would know and not go through or correct or start a policy that would be other than for the employee themselves. That would sort of help and let people know that they need to abide by what the federal requirements are.
Thank you, Paulette. Yeah, we'll look to strengthen the information. The federal authority that has been in place for some time says that participants self-directing can offer employee benefits. And so apparently that was not understood correctly to be just the employee. So we'll take that back and emphasize that.
Yeah, right. And hearing this discussion, I can understand what you're saying, but in reading the language, it says employee. And so employee may want to also include their family. So it's just a clarification would help. Thank you.
Yeah, thank you so much. Mary? You have Mary Janzak, yes.
There we go. Now I'm unmuted. So just a couple of things quickly. First of all, an employee, there needs to be consideration that if an employee goes to Maryland Health Connection and gets a policy for not just themselves, but let's say their children, if she's a single mom, there needs to be a way that they can do that and pick the policy apart and state, this is how much is for the mom, this is how much is for the kids. I'm only asking to be reimbursed for the mom's part, because to have to get policies for each individual person individually would be a lot more costly than doing it as a family plan. So that needs to be something that is taken into consideration. Additionally, you're going to be asking for this information for your information gathering venture. It seems like the FMCSs should be the ones tasked and burdened with collecting this information and giving it to the DDA, not the CCSs or the participants or the support brokers, because they're the ones that are paying it. So they should know how many policies they're paying, how much reimbursement they're paying, et cetera. That's where you're going to find all of the information in one spot, rather than trying to collect it from all of the different participants, CCSs, support brokers, and such. And as far as payments that have been made for participants and such, you stated, if that's happened, which I'm not saying it hasn't, but if it's happened, that's the fault of the FMCS. That's not the fault of the participant or the CCS or the support broker. That's the fault of the FMCS for paying something in error. And I don't think that it seems very unfair that it sounds like everyone is trying to blame the participant or the employee for trying to do something nefarious, when in all reality, they probably did not. And even if they were, the FMCS is paid to root that out and not pay that. So I think that the burden should fall on the FMCSs to provide all of this data for you. If you really want to have all the data, they're the ones that are going to have it, rather than trying to gather it from 100 and, however many, thousands of participants there are.
Thank you, Mary. Any other? I don't see any other hands rose. So I want to thank the council and the public for joining us today and sharing advice and recommendation. Council members, if you could share any additional information, suggestions, rewording, etc., and the financial management counseling services providers, if you could share that with us, that would be great. We will send you directly Christy's email address so that you can share that with her. We appreciate information that you could share with us so that we can continue to consider this along with the input for today. Wishing everybody great holidays, safe, and our next meeting, if we could go to the next slide. Keep going. Keep going. Another one. So these are the resources that are available. Our website's available with all those resources that we shared last time. With the legislative session starting in January, we're going to move our meetings to every other month, which is required by statute. So our next meeting will be February 19th at the Southern Maryland Regional Office location, followed by April. If in the event something occurs that we need to kind of pull the group together, we would send out a kind of ad hoc meeting to let you know. But we know that a number of you will be actively involved in the legislative session and want to support that. So thank you again for your time. Have a great day and safe travels.